Hi everyone, folks are starting to roll in, so we're going to give it just a few minutes before we start. And if you cannot hear me, let me know in the chat. I have some internet challenges today. All right. I see we got some folks out there. And I think that we might just be waiting for one of our fantastic sponsors. So I'm going to give Ashley a second to get on the phone. In the interim, I'll ask a question, or no, we'll practice our participant buttons. How's everybody doing today? Can we get a thumbs up or a thumbs down? I like it. All right, I see it coming through. Great. Yesterday, I shared that I was definitely a thumbs down. And Aubrey, somebody who's on this call, sent me a really nice message. I was actually supposed to be on vacation yesterday and today and the 3 days prior because I am a marathoner and I was supposed to be running the Boston Marathon yesterday. And apparently in Boston, the city paused and recognized that they were grieving that the marathon did not go on. But for those of us that weren't in Boston, you know, we didn't get to stream on every news channel the videos of past marathons. And it was a really interesting day. But I am happy that I get to be a part of this community. And so I think that's a nice lead in, because the marathoning is also part of why I'm super pumped that we are having this discussion, because I would likely have had a terrible race yesterday because I got hurt about 6 weeks ago. And when the marathon was postponed, thought, yes, finally my time to take care of myself, and wound up with a chiropractor and a PT who I got to see a whopping one time in person, as I could barely walk before my healthcare went virtual. And I will tell you, I was a skeptic because I thought the entire point of seeing this type of care provider is to offer adjustments and stand with you while you do exercises. And I was really, really skeptical. I also was living in this world where I felt a little uncomfortable. Here's me just talking since I haven't started anything yet, so I'm being super vulnerable. But I wasn't super comfortable with this narrative that I was going to be on film or video doing this, even though nothing was being recorded. But it's actually worked out beautifully, and I keep getting cleared to do more and more activity. And I'm not sure that I will ever go back in person at this point, because it's super convenient. It happens in 30 minutes and I don't have to drive anywhere. So anyway, there's my personal story before we share this. So I'm gonna, I think Justin mentioned I may have cut out a little bit. I think that may just be a challenge during this, this webinar today, but I'm gonna go ahead and get us started. So please welcome to the importance of virtual care during a pandemic. I just gave you my own personal story. I can also walk, and I have learned that a lacrosse ball, while not a perfect substitute for a masseuse, is pretty darn good in the event of a pandemic, and it cost me like 79 cents. So we'll go on to our next slide. And we'll kind of go over some of our rules of engagement. And this may be something that we go ahead and do, particularly if my audio is cutting in and out, or Ashley's. We have everybody muted. We're going to ask everybody to remain muted unless one of us on the staff unmutes you. And so that's where we'll use the participant hand raising on the participant side. And then we're going to ask everybody to disable your camera unless you're asking a question or presenting. We record these, and I'm not sure how familiar you are with the Zoom platform, but when you're doing the recordings, all the video that other people are showing actually adds to what you're trying to record. So that's some of the bandwidth challenges. You can shoot me a question, or you can shoot the TAO admin a question, or you can shoot Justin Martinez a question, or you can do your question publicly in the chat. And then we talked about our nonverbal participation options. So thumbs up, and that's how we will do our round of applause. All right, next slide. So we have been asking folks to follow us on social media, and I think maybe people are tired of seeing screenshots of a Zoom webinar, but if you feel like taking one, we always like to have our speakers in the background, and then we give them a little social love too. So those are our platforms, and feel free to connect with us during this conversation. And then on our next slide, I may actually be done talking, which after 8 minutes, you all may be happy about. Oh wait, just kidding. Not a reality. If we run out of time, we have a members only platform called Mobilize, and we've been taking our questions that are in the overage of our allotted time into Mobilize, so our members can see kind of what we talked about. And this is where we're linking to our YouTube channel, so you can see the videos. It's awesome if you're not a member and you're like, man, I'm missing out on the post conversations, the after party. Feel free to reach out to Justin Martinez, and we can talk to you about how to get more involved. And then maybe I finally introduce, nope, still us. Okay, so I've talked a lot about me, and that was me and Justin, and we're your hosts today. So I will pause and take a breath and mute myself, and I will introduce Ashley Powers. Ashley owns marketing for the region from Comcast Business. She has been an awesome partner over the last 6 weeks. When we had to shift to virtual programming, she was our #1 first supporter with the Comcast Business team. So without further ado, I am going to hand it over to Ashley Powers. This is a to Ashley presentation today.
You can call me Ash. We can have an Ashley and an Ash, and we're good.
I like it. Well, thank you for having me. Comcast Business is really excited to be a part of this webinar series. It's brought great content to the Portland community and Oregon really community. So we're excited to be a part of this, and excited that Ashley is presenting this topic. So Ashley is a senior manager of product at ZOOM+Care, who is obsessed with improving the healthcare experience for both patients and medical providers. She has been there for almost 7 years and is a fellow graduate of the University of Oregon. Ashley works closely with developers, designers, and medical providers to build solutions for patients to access care virtually, which is the topic of our conversations today. So I will hand it over to the other Ashley.
Awesome. Thanks for that intro. It's always funny to hear people talking about me. Okay, I am going to apologize in advance. My screens are being a little funny today, so I'm hoping you can see me well and that I'm looking at the camera in the best possible way. There we go. Okay, wonderful. So, hi guys, welcome. I encourage you to participate. I don't want to have the whole 25, 30 minutes or so where I'm just talking at you. I'd love to answer questions, have healthy, happy debates about some of the things I'm going to talk about. This is largely from my point of view and my experience that I've learned through Zoom and what we've been working through. Really, we've been in virtual care for about 11 years. We launched video care when it was still Skype as your solution. And then we've evolved over the last 5 years, really reinvesting. So a couple things that we're going to talk about today. We're going to talk about virtual care as a whole and kind of answer the question, is it flattening the curve or not? And there's some healthy debate in the industry of whether it really is. The good news is we don't really have a choice. And so it's a good time for virtual care from an adoption standpoint. I want to talk about, it's great that we're adopting it now, but what is it really going to do for long-term adoption? What do we need to keep in mind as industry leaders, as we want this to be part of care as we move forward? And then we'll have some time for discussion, questions. I'm an expert in some things, not all things. If I don't know the answer, I can definitely direct you to somebody who does. I'm lucky to work with a really cross-functional group of people that are focused on this. So can virtual care utilization help flatten the curve? There's some really great debate out there of whether it's truly flattening the curve or not. But the reality is it doesn't really matter because we don't have a choice right now. The US is plagued with not having enough PPE, not enough resources, that if somebody needs care, virtual care is their new front door. And so the beauty is, especially here at Zoom, there are many different mechanisms of what virtual care is. The most common and probably the most legacy that folks are familiar with is video. It's been around. Zoom launched it in early 2010 for the first time. We called it takeout videos, which I'm still not sure where that branding came from. And the most common scenario is that it's synchronous video that allows for the most similar experience for an in-person visit. I would say about 80% of what you would do in an in-person visit can be done during video. A newer to the market, and there's a lot of players out here. There's ZOOM+Care, but there's also 98.6. There's Medici. There's many players. Is chat-based care, and there's asynchronous and synchronous chat. ZOOM+Care focuses on synchronous chat. So that's really the connecting with the provider, having a one-on-one conversation. Many of the times the provider is actually seeing multiple patients at one because there's lag in communication. With the ability to send multimedia, such as photos, it really can allow patients to receive high levels of care via text messaging, essentially. We often see that folks are coming in for lacerations before they need to come in, eye infections, things that you wouldn't expect. We've had cat bites that we've been able to treat without having you have to come in over chat. Telephone, probably the most simple of the technology solutions, is a synchronous solution that's out there for folks. Both chat and telephone tend to be most common for established patient use. And the reason behind that is really when it comes to medical regulation, while Oregon is pretty progressive and doesn't have many regulations of what medium can be used for new and established care, many of the states are not there. So at Zoom, we actually are in compliance with more of the Washington standard. We apply that to Oregon. And Washington requires patients to have at least one face-to-face visit. The duration of time in which that's relevant is up to the provider. We've chosen 3 years as it fits with medical billing. So you must have one in-person visit to really use chat and telephone at the top of their service. Other than that, they're great triaging lines to make sure that you're getting to the right level of care, which is valuable as well. Messaging and email, while maybe not as sexy, is ideal for follow-up and continuity of care. You don't need a visit for everything. You don't need to bog down the system, but sometimes patients just need an answer to their medication refill, if they're getting better, and these kind of asynchronous communications are ideal for that.
Hey, I'm going to interrupt you for 2 seconds. It's Sarah.
Please.
I think we're having trouble seeing your next slides. We're still on the first one in the presentation window.
Okay, let me try that again.
And you did mention some multi-screen stuff going on.
Yeah, let's just simplify this instead of projecting.
Thank you. I hate to interrupt because I was like, no, this is great stuff.
No, my visuals are pretty, I made them pretty on purpose. So give me 1 second to anchor this guy a little bit differently. It wouldn't be a virtual meeting if there wasn't something like this that happens.
I mean, that's the whole beauty of virtual. I mean, at least no one's partner is strolling through, dressed. And I don't know if anyone's disembodied child's head, because you have a green screen up, is in asking for lunch. So we haven't seen any of those. So this is probably minor. There we go. I think that looks perfect.
Okay, everyone can see a virtual mediums slide page.
Yes.
Okay, fantastic. And my video should be back on as well, so you could see me as we toggle. Wonderful. So I was just kind of going through these very simply. Luckily, the slides were very simple. So one of the new emerging pieces, right, is using automation and chatbots. And then, hold on 1 second. Can you see anything still now? It's, there we go. Sorry, it moved for me. Okay, so chatbots, AI, automation. This is still largely the conclusion of how it's going to play out in the field is new and emerging. There's many different tools out there. It's really a great tool, I would say, for managing chronic disease. So medication refills, diabetes management. We have simple things like birth control that are being automated through this, where the providers that are doing this in person are typically following an algorithm. How do you reduce the time with a bot and automation? And we'll talk a little bit about the vectors in which make these things relevant and usable. But ultimately, regulation needs to be behind all of these for them to really be adopted. And I would say regulation, if we go from face-to-face to bots, is kind of degrading from there. There's a lot of clear understanding of how to dig into video, where the chatbot and the AI, the regulators are still getting caught up with, what does this mean for care? How do we do this safely? How do we make sure that it's covered? And so more to come on that conversation. So there we go. While flattening the curve is probably not completely measurable as virtual care as a driver of it, the pandemic is changing virtual care. And that's ultimately the beauty of this in some sad way. But last year, the American Medical Association did a study, and it found in their populations that they were surveying, about 28% of the population had utilized virtual care. That's up quite a bit from 2016, which was closer to 14%. Ultimately, right, virtual care had not had its moment up until this time. It's something that's been talked about. There's been lots of buzz, but it was super focused on rural communities who didn't have access to providers. It was emerging around behavioral health, so our mental health folks, but it hadn't made its forefront as somebody who gets care all the time. You'd still go to urgent care, you'd still call your PCP, the hospital front door was still there. And most of those relationships where people were using virtual care were focused on already having a relationship with a provider. Some of that was because the law required it. Others were just because that's how you learned that it was available to you. It's not the first thing on a patient's mind to think, do I go to a video visit? I'm gonna go find a doctor is usually the train of thought. And pay parity was part of that driver. Ultimately, the insurers and the regulators had not gotten to a place where it was clear on what was going to be covered for virtual care. In Oregon, we're lucky. There is parity laws, but they are not flawless. There is loopholes when you get to the federal level, and most employers are buying insurance for their employees, and it's federally mandated, not state mandated. And so there's gaps in coverage. And we'll be talking a lot more about that as we continue forward. And then HIPAA, something that we all strive to make sure that we are practicing at the top of the line, prohibited the common use of virtual solutions such as FaceTime, Google Hangouts, Zoom, which we're on today. As we're in the middle of this COVID experience, we're seeing utilization totally shift. So on average, the surveys are still new, but as you look across, adoption has gotten to an 80–90% of care is being delivered either by one of those 5 mediums that I've talked about. We are definitely seeing that at Zoom. We have moved At one point, almost 100% of our business was virtual. We are slowly bringing back some in-person care as it's needed. And then virtual is being used by all specialties. To Kara's point about physical therapy, who would have thought, right? That seems like a very highly manipulative in-person therapeutic method. And the reality is they can verbally walk patients through what they need to do on their own. And then we're seeing, at least at Zoom, that our relationships that we're forming over video tend to be new. They are for the first time looking for a doctor and they haven't had to find one previously, and what's available to them is video, and they're trying it. And much like Kara said, like, we've had many patients say, I'll never want to go back. Why would I ever drive, wait in line, sit in the waiting room if I could just be at home while accessing my provider? Consistency among payers is increasing. It may be temporary, and we're starting to see that video care, phone care are covered like in-person visits, which really allows insurance to be used, but also for the providers of care to be reimbursed. It's also a business. It needs to be scalable. And when there's inconsistencies, it gets hard to invest in moving these mediums forward. And temporarily, we've seen regulations really lax. I believe this will be extremely temporary, but folks who don't have mechanisms like we are lucky at ZOOM+Care to have to build our own solutions can use FaceTime, Google Hangouts, other pieces, because the game is really making sure that people are still getting care even if the physical experience is not recommended right now. So I want to pause real quick and see if there's any questions. Let me see if there's anything if there's not, maybe Carrie, if you can see, I'm having trouble with my smaller screen seeing chat.
No, you're fine. You keep that on. I actually do have a question, and you may get to it later, but I feel like since we're sort of talking about it right now, and you touched on, I can't remember your exact phrasing because you work in real medicine and I work in fake medicine, or not medicine at all. You talked about, like, physical therapy being the sort of like the hands-on manipulation. But one question, and I don't know that you've touched on it yet, but is around mental health that we received. So what lasting effects do you think the next few months will have on the telehealth industry, especially when looking at mental health care? And I've actually heard a couple of things on NPR that's been one that's super challenging, particularly when you're looking at couples therapy and like the HIPAA compliance around that. So if it's not jumping ahead, I'd love to go ahead and get that question out there.
Yeah, it's actually, I'm going to answer it.
Okay,
my whole next piece. So I'll jump to that. I do want to pause for 1 second. Ian's asking a question around impacted roadmap and changing priorities, stress product delivery. Everything changed, Ian. I would say our entire strategy was built around virtualizing care previous to this, but the time frame in which we wanted to innovate in this factor was condensed to days versus weeks. And so at Zoom, one of the things that we needed to do is we had this year-long roadmap that was essentially moving most of our business in this direction anyways. And we started to accomplish those in a series of days. And so we reorganized people, processes. Our leadership team has been very connected. We've probably connected more virtually than I ever did in the office. And we're a fairly small, tight team for what we do. And so some of that was we had to make trade-offs. What is the value of what we're doing, and what are we willing to not have perfect while moving forward? And so for us personally, we expanded our chat service into a different market, and we had not anticipated doing that till later this year. We changed our video platform to be more scalable and instant in 9 days. That was something we were going to do over the next 3 months, knowing that maybe the solution we came up with isn't forever, but it was going to solve the current need. And so I would say that I hate to say to practice the agile principles, because sometimes that gets a little tried, but honestly, it was probably the most I've ever had to practice the principles that are part of being in a product. I hope that it helps answers your question at a high level. Okay, so I'm gonna continue going through this. Let me go back real quick and exit out of this guy real quick and present again. So great segue to what are the like long-term impacts we're going to see across virtual care. And I will definitely talk about some of the specialties that I think are going to be heavily impacted by sustainable virtual care solutions. And so, you know, ultimately, why does it matter? Virtual care has the potential to be one of the lower cost of care for patients, insurers, and employees. And there's many different reasons for this. Some of them are as simple as like, it makes sense. Once you stand up the platform, some of your other variable costs go away. But that's actually not the largest reason behind it. The reason is if you can get patients in the door at an earlier point of care, so before it becomes chronic, before it becomes an issue, you can direct them to the right level of care before this becomes a larger thing. So more frequent touches for less critical things actually results in better care. At Zoom, our mission is twice the health at half the cost and 10 times the delight. And so virtual care fits into that perfectly. And ultimately, the lower cost of care is partially for the patient. They need to feel that. But insurers and employees are the ones that are actually fronting most of the cost. And if we can do some systemic changes to the way that cost is felt, ultimately the patient will also feel that. And so this is my checklist for how I think about creating a longer term virtual care adoption. And it's really around 6 different things that we're going to dive relatively high level into, but at least give you guys a framework for different ways to plug into this. So one is how virtual care fits into the healthcare delivery system. We're going to talk about how it has to be a solution for both patients and providers. We're going to talk about the technology. I think we're all in that world, and so it's important to keep that in mind. We're going to talk about how awareness needs to switch, insurance and the employer, and then the modernization of regulations. And so at its core, right now in the industry, we're seeing so many virtual care players out there. I forget the stat exactly. I tried to look it up and got a little distracted yesterday, but CB Insights does some great coverage on the virtual care space and the amount of investments that is going into it year after year. And it's been topping every year. The reality is if that virtual care solution isn't coupled with the patient's in-person care and delivery system, it's going to be very hard for long-term adoption. These virtual care solutions need to be coupled with how somebody can also get in-person care. We may be able to move where 80% of all care is done virtually. That's what some of the industry leaders think we're capable of. But that 20%, you're still going to need stitches. You're still going to need imaging. There is that physical exam that needs to happen. Visual exam can happen virtually. So my lasting recommendation is that as folks think about leveraging virtual care, either if you're going to build it yourself or if you're looking for it for your employees, is that you find a solution that's tied, coupled, closely with a delivery system that offers in-person care. And at Zoom, one of the things that we've been really focusing on is that we have a shared virtual platform in EMR, so that when patients come in and do a video visit, a chat, or their messaging, that record is shared with their in-person providers. We don't assign PCPs because you're part of the entire platform. It's a team of doctors that have the right access to your information. And that way you're not barred from going to any clinic, any Zoom provider on video. And then the coupling with delivery services. We've got Amazon for everything, right? Right now, I think everyone's experiencing its own scale problems with that. My Drano was gonna take 4 weeks to get here. I just went down to the store instead. But meds, labs, that needs to be in the same principle. If somebody's choosing to get virtual care, they wanna be home. They don't wanna have to have the inconvenience of going to the pharmacy, waiting in line. And so Zoom offers a home delivery medication service, and many employers and insurance have that available to them as well, but it needs to be tightly coupled with the provider and the patient having the same access to those services. On that same note, the solutions have to be thought about for patients, providers, and support staff. If you're just going in and solving it for the patient, say the patient just loves a certain way of accessing it, you're likely not going to solve for the people that are having to provide care. Time and time again, if we are building solutions that work for our provider, we know they're going to be great for our patient. And one of the reasons for that is if the providers don't adopt it, they will direct their patient to go somewhere else. We learned this. In 2011, we went to Skype. This was before HIPAA regulations for virtual care were fully understood. There was no clear BAA system involved. And our providers hated it. And they ultimately did not encourage patients to use it. And so we saw pretty low adoption until we changed our technology. And ever since then, we've been on a much better place. So technology and strong networking. One piece of this is the actual platform, right? There's video technology, there's chat technology, there's bots, you name it. And there's a few different ways that somebody can build it themselves. We like to think about it as build versus buy versus partner, pretty standard in our industry of how we think about doing things. But as you think about that buy, there's really a couple different ways of buying and hybrids of this. And so there's the buying a full solution. There are third-party players out there that will white label everything. There's trade-offs with that. You don't get control over the data sometimes. You don't get control over the experience. It can be hard to make moves as you learn more. There is the buy and build, hybrid, where maybe you build the experience and you buy the back-end technology. Players like Twilio are really starting to invest in HIPAA compliant technology, and Zoom is HIPAA compliant. There are many players out there that will just give you the back end so that the industries or the players don't have to become the expert in the web technology. They can become the experts in the experience. And that's really that buy partner piece. And at Zoom, we've chosen to do kind of a hybrid model. We are fanatic about controlling the patient experience. We're not perfect, but that's what we're always striving towards. And so for us, it really was about, we want to be in control of that experience for our patients and providers long-term. That's how we gain traction. And so we've looked for partners that allow us to provide the video technology, provide some of the chat backend, but we control the rest of the experience, everything from UI to data to training. I mentioned earlier that HIPAA compliance is ultimately kind of being laxed in this moment, but for us to get scale and to really have long-term adoption, patients need to know this is safe. And providers need to know this is safe. And so, like I was just saying, most players are starting to do HIPAA compliance technology as the industry is moving this way. Twilio has a pretty robust offering as of late, and Zoom is definitely at the top of their compliance for the HIPAA solution. We've obviously all are aware of some security issues that they're experiencing right now, but from a BAA standpoint, they're quite progressive. So those lax FaceTime, et cetera, I don't think are gonna last. The question is though, will those players like Apple's and Samsung's who are heavily invested in things like Apple Health, are they going to start to provide solutions that have that level of encryption and security that allow any platform to be used? It'll be really interesting to see if we move in that direction. The technology needs to be accessible from all devices and browsers. This one seems so simple, right? But one of the things that we've come across as we've gotten closer into the industry is they don't all play nicely. And so the video experience and the chat experience may work one way on a desktop, totally on a different mobile experience. You're gonna lose functionality. And that's cool when there's known trade-offs, but many of the players are just still evolving. And so most of the situation requires you to download another app, to go to the desktop if you need things. And so what we recommend is, as we look across this, really finding players that are building it into the browser so that you don't have to build another application and have more hoops for a patient to go through. Ultimately, right, this is about removing barriers to care at a lower cost. And so that technology needs to be in place as well. And very fitting for Comcast to be here, but broadband and Wi-Fi. I think we're all experiencing, as Kara's having voice problems today with Wi-Fi, the usage is high. And both the provider needs to have this and the patient. And if it's not married together, it can lead to a really poor experience. And that's one of the reasons that for many years, Zoom heavily invested in chat as its sole front door for virtual care. And video is great as well, but chat has lower barriers to entry. You don't need the same level of connection. You don't need to have makeup on. You could be in your pajamas. You could be multitasking. And so that synchronous match really helps with some of those areas where you don't have that optionality. And, you know, with all of these things in mind, the virtual care technology needs to be invisible, right? That's really what I'm getting at. The experience needs to be so simple that patients just have it as part of their everyday access points to plugging in, versus many steps, many downloads, and really they shouldn't have to be trained to access the technology that's available for them. Awareness. We know about it now. But beforehand, as I was talking about, the adoption has been really, really small. And so how does this become the front door of modern primary care? It ultimately is so much easier, especially for mental health. Mental health patients on average are suffering from anxiety, depression, fear of going outside. It is challenging to get to the doctor to help you. I'm a mental health patient myself, and it took me years to actually get there. If I had had a virtual service available for me, I'm not sure how much faster I would have gotten. I don't even want to imagine it. And so getting to that point of how you make this aware is it needs to be socially something that we talk about. It needs to be available from an insurance and employer standpoint, which we'll talk about next. But ultimately, it's about keeping that narrative going. And over time, the awareness needs to be just as common as urgent cares were, as primary care was, right? We have shifted from an emergency care as the front door to urgent care to primary care. And now the next phase is really around virtual care being there. And so many of you are leading teams, part of organizations. And one of the main ways that people get care is through their insurance. It seems simple enough, but if insurance does not cover virtual care, folks won't use it. And so prior to this time, it was, I mentioned this previously, but just lack of coverage, really bad reimbursement. If you had the benefit, you had to search for it. And we're starting to see that shift. And it's really being promoted. There are players out there like 98.6 that just cater to being available for employees. And that's something that Zoom really cares about as well, is ways to access that through the coverage that you're already paying for as an employee and an insurance, employer and employee. So I'm curious how many, as this is such, I'm just gonna switch real quick. I'm curious to how many people have that as part of their coverage today. Is virtual care something that's in your insurance toolkit? Is it something you knew about before this time?
I'm always happy to start so people feel like they can talk. This is Kara.
Hi, Kara. Thanks.
And Justin is saying yes, because we've experienced this with just my PT opportunity. When the first appointment was scheduled, the insurance was yes. And then when they went back and looked at it, the insurance was a no. And then it actually came back to being yes, that it is covered, and actually covered at a higher level, because my in-care insurance provides me the opportunity to talk to the physician in network. The out of network cost was the actual physical hands-on manipulation and tissue work. Right. So it was more cost effective for me to do it virtually than it was in person, even based on my insurance. Yeah. So, and not something that I would have never looked into, because the $10 a session is way more palatable when you're doing it 2 or 3 times a week than $65. So I think we've got a couple of folks in there. Nate Webb is saying that they recently built a product around engaging the patient at home and then virtual, and he's sharing that with us. But
yeah.
And I'll jump in. Thank you for that. What's interesting that we're determining about the product is the different geographical use cases, right? Excuse me. So in an urban setting, it's super important, talking to people in New York right now, to actually find the location of the hospital. Mm-hmm. This application uses sometimes third-party technology like Aruba networks or Cisco networks to basically alert the patient once they've entered that environment, and then wayfind them to the actual appointment. We're finding in a rural community that that's not necessarily as important, right? Because in Medford, everyone knows who the doctor is. So the value is to really, what you're talking about, this idea of telehealth on the back end. So if I'm a patient in Medford, I know where my doctor is, but I don't want to have to potentially drive that 2 hours to Peace Health, excuse me, in Eugene. I much would rather have this, you know, which Zoom has obviously done an incredible job around this idea of super highly protected ability to message my doctor, even show, you know, bad example, picture of a cyst or something,
right,
and have that discussion with the doctor. So we're beta testing this product right now and getting some really interesting feedback based upon the geography of the population.
I think it's a really good point. And it is totally different. So that piece that I was talking about, I'm going to go back to my presentation real quick of this new delivery system. This combo is really relevant, I would say, for the urban and metro areas. For the folks that are in the more suburban or rural areas, they know because their choices are totally different. And so what Zoom is also starting to see, Nate, is that when we've launched this service, we're no longer inhibited just to our geographical range of clinics. We're able to see the entire state.
That's so awesome.
And so it changes the whole way that you have to help a person with these delivery systems with the next step. And majority of the care can be completed virtually, but you need, you know, antibiotics. If there's a test that's needed, we're going to do the test. Just because you have virtual care doesn't mean the care should lax. And I think that's often a patient misconception. We run into that and have to coach our providers on better conversations. But it really is an interesting change of how geographics of care will change as this becomes more readily available. So true. Thank you for that. Yeah, no, I appreciate your comment. And so lastly, and then I would love to just kind of have a conversation is the rules and regulations continually need to modernize. Zoom, our previous founders and owners were heavily dedicated to lobbying for progressive rights. We were behind the first bill in Oregon that required video care to be paid at parity of in-person visits. And we're continuing to dedicate to that. But ultimately, if we don't see longer term adoptions at the federal level to parity, to technology advancements, we're gonna see a standstill of adoption. And so I'm hoping and I'm optimistic that because this has become such a forefront due to this current outbreak, that we see some traction, but it's gonna take some folks lobbying and really being persistent that this becomes a part of the federal regulation. And the reason I say that federal is important is most large employers are on self-insured employer plans. And so Adidas, Zoom is ourself. And you're under a different regulation from an insurance standpoint. And so it doesn't need to be at parity. It doesn't need to be covered at all. It's completely up to that employer. And so if patients don't know that, that gets challenging for them to navigate the space. And it gets challenging for providers to know who they can care for. And cost is just an inevitable part of that conversation, as we're all aware of. So just some wrapping key pieces. We're seeing an acceleration of adoption. I think I've made that point pretty clear. From my point of view, being a part of that healthcare delivery system versus standalone solutions are really how we're going to see scale. Patients just don't want to tell their story over and over again or have to track down their data. It needs to be designed for the entire medical experience. It can't just be about the conversation. It needs to be about meds, labs, imaging, that next step for it to really be adoptable. Doctors are just as much of a customer as a patient. And then HIPAA compliance is not going away, nor should it, and it needs to be considered when you make technology changes. And then I recommend staying involved with some of the change agents that are outside of the technology space. These are a few links that I'll have this available for you guys afterwards, but the AMA has some good resources. There's also some CMS resources, some CARES Act. Today, I got an email this morning talking about how they're trying to make sure that diabetic programs are now covered for asynchronous care. And that was previously something that your either employee paid for or you had to pay for out of your pocket. So we're continuing to see change, which is the awesome part. And I think we're just at the beginning of seeing how this will play out. And just at the beginning of where the technology will be as well. I am under the impression that we're going to move more and more asynchronously versus synchronous as this really becomes part of everyday life to do virtual care. So I am available for questions, comments, debate what I said. I'd love to hear from you guys if there's anything that is on your mind.
Ash, I've got one more. This is Kara that was pre-submitted, but we definitely want to see, y'all have been a really engaged group, and so I'd love to see some questions come from them as well. But this is more, this might be more of a culture question that's specific to ZOOM+Care, and I know I'm suffering from some of this. So I am single and I don't have a family, and so a lot of my hours after hours are also spent in flat screen chats at the moment. And so what are y'all doing internally, or what are you recommending to balance the amount of hours that you spend in these Zoom sessions versus, executing against your work and or living your life in a three-dimensional world?
Yeah. So we joke that our CEO is more of a cultural officer than anything. So we're fortunate that, so twice a week, our business comes together as a whole and really resets on what it means to be virtual and disconnected, but then also completely connected all the time. I think I've seen my team more than I did in person when we sat in the same row. And so what we do during that time is they're really encouraging us to build practices along unplugging. Put your Slack on Do Not Disturb, go out for a walk. We're starting a walk challenge next week, or I think it starts tomorrow. From a cultural standpoint of what we call our headquarters, which is base camp, there's a lot of support there. I think it's much harder for the providers. This is totally new. They're used to nonstop real human connection. And so now their workflow is in switching between video visit to chat to phone, depending on what their schedule looks like. And what we've done when we build the technology is we give them the control to own their day. So on the back end, we're not giving them a front-loaded panel that they have to see. We're saying you control your capacity, you control who you pick up. It's queue-based in some of the instances. We can set their schedule. And so that way they're in control over when they need a break and when they don't, because the brain gives out when it does. And I encourage that same, and the only reason it works is because we have a culture of supporting it, right? If we didn't, then it would feel like it was falling on deaf ears. Like, okay, you gave me this control, but then you're asking me to see 35 patients today. And so instead we really try to give it to them and then give them rails of where their good spot should be given the patients that they have available to them. And I think the same thing goes for people that are not giving patient care. You have to have some rules and rails and know that this is a weird time, and self-control. I'm also like you, Kara. Last night I was like, why am I still on my computer? I don't need to be doing this right now. So it's challenging. I don't think anyone has the full answer other than trial and error for themselves.
Yeah, it's challenging. John has a question. Say a little more about your conclusion of things becoming more and more asynchronous. I remember the slide with video, chat, phone, messaging, chat bots. Most of those seem synchronous.
Yeah. Well, chat, messaging, and chat bots, I think, are the ones that are going to be synchronous, or asynchronous, excuse me. Video and phone, those are going to be very challenging to move to the asynchronous point. But I'm, in my own life, and from studies we've done, our adoption of our chat care service, which is a little bit more asynchronous than synchronous, folks can chat for 45 minutes to an hour, depending on what they're doing. The adoption and the return rate is really high. On average, our folks are using it anywhere from 7 to 10 times a year, which in healthcare, the sweet spot of returning to a system is usually 3 to 10, depending on what you're offering. So when we look at the market and we look at patient behavior, people are busier. People don't have the same time. Zoom was founded completely on the principle of being convenient at a lower cost. And as we try to apply that to where the market is moving, that synchronous communication, I think, will be a level up. And people's true front door will start to be sending a message, talking to a bot, looking up a resource that puts them through a flow, or sending a message and then escalating up. So lower entry points, with still having the option of video and chat for full visit lengths. I hope that helps answer your question.
Has got it. Thanks. I'm used to
yes.
that disconnect.
You know, part of it is the way we built the system is it's part of the patient's profile. So they still log in. They're still part of it. It's almost like a little bit of not a trick on purpose, but it's a design principle of making sure that it still feels like they're connected with somebody and getting one-on-one attention, even though they are being served, the provider's seeing multiple patients at once. So I think that helps with them staying engaged. Exactly, John. Nate, we don't. We actually have built everything ourselves. We, for better or worse, I won't lie and say that there has some challenges of building your own EMR, your own, our chat base is using an open source backend, but everything was built on our end. Video is the first time we've partnered a little bit more, where we're using a third-party video solution, and moving towards controlling most of this care. I think we're evolving though, because the players in the healthcare space need to start talking to each other more. And Zoom was founded on, if we do it ourselves, we can do it faster, we can do it our way. And the reality is, whether it's moving to FHIR records or just making sure that it's adaptable, patients, who we call Sarah, need to have control over this. So we're constantly evaluating, do we continue to build ourselves, or do we offer solutions that are more connected to the whole entire system? So I think you'll see some changes from us in the next probably 15 months on that front.
Awesome. Anybody else have any questions?
Well, if there's not other questions, you guys can always feel free to reach out to me on LinkedIn. I'm going to do a shameless plug for trying our services, and you can always send me feedback. We're not perfect. We're always evolving, and I love real-time user feedback. But the other thing that Zoom's focused on right now is packaging up our virtual care services as employee and membership benefits. We are previously, for anyone that's been in the Portland market knows, we offered insurance. This is not that. This is really making sure that all employees and insurance have virtual care available to them. And so in my slide deck that will be shared around, we have some content for some content information for our growth officer, who's helping connect people to the right virtual care services. So maybe Zoom's not the right folks for you guys, but we have connections to all the players that are out there. And we just want to make sure people get access to this. Great. Well, thanks for such the engaging questions. I appreciate it. And hope everyone has a good rest of their day.
Well, Ash Banks, thank you so much. Thanks to ZOOM+Care. I'll do a shameless plug as well. Y'all are a super member of the Tech Association, and you all are partnering with us on some other digital health conversations and initiatives that were going to happen in the fall, but now we are going to move those up because the timeline just seems a little more pressing and appropriate. So thank you for that. And then we'll give one more really big thank you to Comcast Business. Y'all have just been so incredible. And I know that all of us probably don't think about our internet service provider all that much, and we probably should. And I will give them a plug as well. They've got folks that are technically frontline workers and are out risking their health every day to ensure that we've got internet access. So I'm just really proud of our community, and check us out either in Mobilize or online, but we'll definitely have some more programming coming up that has both a Comcast support and a ZOOM+Care insight. So thank y'all for spending time with us today, and everybody stay happy, healthy, safe, well, and sane, or a combination of those.
Yes. Thank you guys so much.
All right, everyone take care. Have a good day.